May I come in?
Yes.
Hi there.
Hi.
I'm Sarah. I'm a student nurse practitioner.
Hello.
How would you like me to address you?
You can call me Amy.
Okay.
My son's name is Joe.
Okay.
Mhm.
For purposes of this video, the mother here, my partner is the mother, and then she will be the patient here when we get to the review of systems. Okay, so do you know much about student nurse practitioners?
I do.
Okay,
Mhm.
wonderful. Tell me what brings you to here today.
Well, my son here, he's been having a lot of bedwetting lately.
Okay.
I'm just concerned about that.
Okay.
Mhm.
So, when was he first potty trained?
You know, I don't remember the exact time that he was potty
Okay.
trained. I know it was, maybe a few years ago.
Okay. Well, if he's 5.5, would you say in his 4s maybe?
Yeah, I think so.
Okay.
Yeah.
All right. It just gives us somewhere to start. So
Mhm.
tell me, does he have periods of dryness?
He does, at times,
Okay.
but, it's like every night he does go
Okay.
when he sleeps.
All right. So how many times in a week do you think?
I would say, about 4 or 5 times a week.
Okay. All right. And so does he have any daytime accidents?
No, not really during the day. He doesn't have any problems.
Okay.
All the time, occasionally there's that worry,
Mm-hmm.
but otherwise it's mainly at night that I've noticed.
Okay.
Mhm.
And is he using anything at night, such as pull-ups or anything like that to help with the matters?
We have like a pad that we put on the bed.
Okay, that's
Mhm.
good. That's helpful at
Mhm.
least. And has he had any history of urinary tract infections?
No.
Okay.
Nothing like that.
All right.
Mm-mm.
What about, how's this impacting him? Does he feel like he can't spend the night anywhere, or does he feel embarrassed?
He has not ever spent the night anywhere else because he's afraid of being teased.
Okay, yeah,
Mhm.
that's pretty typical. That's why I asked. So, all right, with that, let's say I wanted to ask about any allergies to medications. Any medication allergies?
No.
What about to any environmental, any foods, any latex? Okay.
Nothing like that.
What about any medications he takes on a daily basis or over the counter?
Nothing.
Any herbal remedies?
No, he's not. I don't do
Vitamins.
anything.
Okay. Okay. With past medical history with situations like these, it would be important to know when you or the father were first toilet trained. Do you recall that?
Let's see. I don't know about the father.
Okay.
He doesn't. We're not currently together, so I don't have any information
Okay.
on that. For me, I think it was like the regular time, maybe like 3 or 4 or something.
Oh,
like that.
okay.
Mhm.
All right. And based on the screening that you worked with, the Denver developmental screen, it looks like that he has achieved all his milestones there, so
Good.
that's good. And looking at his chart here, I see that he's his immunizations for 5-year-olds are current, and then he's also was good on his screenings for lead, TB, and anemia. Do you recall when his last well child visit was?
It was before he started kindergarten.
Okay.
Mhm.
Think going on to I like to ask about social history and just to get a good, well-rounded picture of you and your family. Tell me a little bit what grade he's in and what school he goes to.
Sure, he is in kindergarten and he
Okay.
goes to Washington Elementary School.
Okay. Is
And
it a public or private?
it's a public school.
Okay.
And he does pretty well there. I mean, I haven't noticed or, heard anything regarding him falling behind or anything like that from his
Good.
teachers. Mhm.
Any behavioral issues?
No.
Does he like his teacher?
Yeah.
Does he have some friends there?
He does.
Okay.
Mhm.
Good. And tell me about your living situation.
Me and my son live together. I work 12-hour shift days, so he
Okay.
goes to his grandmother's house. She watches him
Okay.
on the days that I work. So he does a lot of like video gaming and things like that over at my mom's house because she's she's up there in age and can't
Mhm.
really do the things that you normally would typically do with a 5-year-old. So.
Okay.
Mhm.
Okay. Is he exposed to any smoke in the home?
I don't think so. No, I don't. I don't smoke, so I don't think he's around anybody who
Okay.
does. Mhm.
And what about any drugs or alcohol? Is he exposed to any of that?
No.
Okay,
Mhm.
good. So any siblings?
No.
Okay.
Mm-mm.
And so he goes to the grandmother's, and you said he plays some video games. How much
Mhm.
activity in a day do you think he gets? Would you say less than an hour or greater than an hour
I would
outside
say,
of school?
I would say maybe less than an hour.
Okay.
Mhm.
What about how much time do you think of video gaming time or TV time does he have? Less than 2 hours or greater than 2 hours?
Oh my goodness, probably greater, just because he's over at my mother's house for
Oh, okay.
a while.
Okay.
Mhm.
And are there any new issues, new dynamics of the family going on as far as any unstable family issues that you can think of?
Well, the only change in our family is I'm currently dating a new person,
Okay.
and he gets along great. I've just recently introduced him to him. So.
Okay.
Mhm.
And I ask this about all our patients, but do you think that he's ever been sexually assaulted?
I don't think so.
Okay.
No.
All right.
He's never told me.
Okay, good. All right, so I'm gonna ask a couple questions to your son here, and you at some point you might be able to help out too. But so for one more question before I move to your son, does he snore at night?
No.
Okay, and does he go to the bathroom before he goes to bed? Do you have a routine before he goes to bed to urinate?
Mhm. We try to tell him to go to the bathroom before bed, but
Okay. And what about any recent fever, illnesses?
no, nothing.
Okay. And has he complained about any changes when he urinates or changes in his when he goes to the bathroom, both pee and poop?
Mm-mm.
No. Okay. All right, and so for purposes of this video, I'm just going to ask a couple questions to the 5-year-old, and I would ask questions about if he feels like you have to go more than you typically do, or if you feel like you're going a lot more, but maybe not as much comes out, any burning or pain when you go pee. If he's drinking any more water than he normally does, and if he's having pain anywhere. Those are the big things I would ask, and then I would ask if he feels safe where he lives. And then I would move on to a review, do a physical exam. So, and then I would ask the mom, do you have any questions at this point?
No.
Okay, then we can move on to the physical exam, and if you can pretend to be the 5-year-old. Just have to be creative with all of this. All right, good. Well, I'm just washing my hands here. So our medical assistant did some vital signs, and those looked good. He's 50% out for height, Mom, 50% for the weight. So for purposes of this video, we're going to defer the genitalia portion of the physical exam and the rectal exam, but I'm going to listen to lungs and heart and start with that. Alright. And then usually my patient would be in a gown, but again, for this video, we won't be. Just listening to your heart. It would be on your skin typically. Okay, good. And then I would switch sides of my stethoscope. Alright, and then I would listen. I'm going to have you take some nice breaths in and out. Alright, good. Just like that. I'm going down into the side. Alright, and then I'm gonna listen from the back here. Nice breaths in and out, down. Okay, both sides. All right, good. I'm gonna just feel you take a nice deep breath in and out. Okay, and then you tell me if you have any pain with this.
Nope. Nope.
Okay, good. And then I'm just gonna feel your spine and just look for some symmetry. See if everything's looks good. Okay. And then I would have you lay down and just kind of feel on your tummy. Thank you. And then I would listen and hear some nice bowel sounds. You want me to put your feet up here?
No, it's
Okay.
okay.
Some good bowel sounds, and then I would feel around and look for any masses and everything. Any pain with this?
No.
Okay, great. You can go ahead and sit up. Okay. And we did a urinalysis, and that looked okay. So talking to both the mom and the patient, there's a couple things that can cause bedwetting. One of them is genetics, and so that's why I asked you questions about the parents and if you had any history of bedwetting as a child. And then other things could be that maybe the child is overly tired when they go to bed. So, at this age, we really recommend 10 to 12 hours of sleep, and also only less than 2 hours of video time, and more than 1 hour of activity time. So I really encourage you to stick to some of that to really have a healthy life, and encourage those. So it's important for the growth and development. And other things to consider is just consider that between the ages of 5 and 7 is a typical time when children grow out of bedwetting, okay, when their bladders become mature enough to get through the night. And then and it's usually occurs more in boys than girls. So with all of that, do you have any questions or concerns?
No.
Okay, all right. I can give you some more information and some tips to help with the bedwetting, and such as, like decreasing the amount of caffeine or sugary things towards the night, and just really getting in a good routine with going to the bathroom before you go to bed, and just regular habits of urinating throughout the day. So I can give you lots of good handouts on that, and I'll be back with that. Thank you.
Thank you.